my name is Christine Singh. I work here at the Prince George office. I'm a physical therapist. And before I get into concussions, I just want to put a little plug. You are sitting in our physical therapy department right now, and we're really fortunate to have as much space as we have here, and we try to really utilize that with doing a lot of functional training and strengthening, in addition to the traditional modalities and things like that that are still very valuable with physical therapy. Going into concussions, this is a very hot topic all the way from Pee-wee to professional sports right now. It's not just a ding. They didn't just get their bell rung. They don't just have a stinger. It's just easy to brush it off, especially when you get to the high school, the college, and the professional level. These athletes are intense, they're competitive, they don't want to take time out. But the reality of it is, even those little stingers or dings or bell ringers set the athletes up for something called second impact syndrome, which basically is a second concussion, either a mild or a severe one, that occurs before the brain has fully healed from the first one. So just a few quick statistics on concussions. Less than 10% of concussions result in loss of consciousness, so that cannot be a diagnostic factor. There's a lot of other signs and symptoms to look for, and I'll go through those in a couple slides. Over 140,000 athletes get concussions every year playing high school sports. That's just high school sports, and that's only what's reported. Just like with ACLs, it can be a non-contact. It doesn't have to be a collision with another person. It can be a collision with a wall or the ground, or a ball or anything like that that can cause the concussion. And not all concussion symptoms occur immediately. 10 to 15% of concussions have symptoms that will continue to present and evolve 10 days, even 2 weeks, even a month after the injury. So it's something that needs to be continually assessed and reported. So as far as sideline management, that's going to be the first line of defense. There's kind of three things to look at. First of all, did a concussion occur? When in doubt, you need to assume that it did. If you do decide, okay, yes, a concussion happened, next step is there immediate need for referral to a medical professional? And that's where you're looking at, was there loss of consciousness? Are we worrying about a spinal cord injury, a bleed, a fracture, anything like that? Is there unusual behavior or a deteriorating condition? They may get up and get off the field on their own, and then 5 minutes later, they can't hold themselves up anymore. This, as far as the Virginia State High School League, this is law as of 2011 or 12. No athlete with a suspected or actual concussion should return to the practice or a game on the same day. Okay, it used to be if symptoms clear within 15 minutes, they can return. That is no longer the case. As far as the return to play protocol, again, I'm not going to go too much into this because I don't want to steal Hunter's thunder. But basically, the bottom line, athlete must remain asymptomatic to progress. And if symptoms do recur as they're progressing, then they need to stay at that previous level before they go back. Concussions are hard to diagnose because you can't see it. And a lot of times, patients tend to thrive on that visualization. They want the x-rays, they want the CT scans, they want the MRIs because they think that's going to show something. With a concussion, it's not a sensitive test. All right, so going into some of the signs and symptoms, problems in brain function. So is this person confused? Do they remember where they are? Do they remember the score of the game? Do they remember who they're playing? Do they remember the basic things either immediately before the injury happened or after? And how the rate of their brain function. So are they answering the questions in an appropriate manner? Are they taking longer to answer than normal? And that's where it comes to where you know your athletes. You know what they're like normally, and then you can tell if there's a difference. And if there is any of that, you have to say, yes, they have a concussion. As far as the management part of it, this kind of goes along with the return to play, and it has to go hand in hand with monitoring the symptoms, but there's not a first line defense pharmacological management. Tylenol, if they have a headache, but nothing other than that. Acutely, make sure they're getting sleep 6 to 8 hours, but not that they're sleeping 12 to 14 hours and not waking up. They need to have a quiet environment. They need to limit their exposure to television, to video games, to computers, to cell phones. They need to let their brain rest, just like you would if you sprain your ankle. You need to elevate rest. Now, as far as physical therapy goes, there's some things that we can address if somebody has had a concussion in the clinic. And the two biggest things would be not chronic, but I would say 2 to 3 weeks or a month out. They're still having headaches. All their other symptoms have resolved, but they're still having headaches. There's things that we can teach them as far as postural exercises, stretching, things like that, modalities. And then the other aspect that we can really incorporate physical therapy into concussion management is when there's balance or coordination issues. We have variable surfaces, we have multi-step, multitask activities, functional training, sports simulation activities, visual and vestibular retraining. Of course, if they have a concussion in conjunction with another injury, we're going to be rehabbing them anyway for that injury, and we can monitor the signs and symptoms ourselves and incorporate some of this stuff into it as well. So some of the non-sports related factors of concussion, short and long-term memory problems can last, and I touched on this, a few days to several months. So it's something that people can be dealing with for a long time, or it could just be a really minor one. They heal, they get back to what they're doing. After a concussion, it's recommended to decrease the athlete's class load early in the recovery process. This is something at the high school level that can maybe be negotiated, but it may not always be possible. But the video games, the computer games, the cell phones, all of those things, that really needs to be reiterated. Young people are addicted to technology, and it's not going to help their brain heal. So limiting exposure to those things is important. And then make sure it's getting reported to the appropriate staff. As far as prevention goes, not everything can be prevented, just like with ACL injuries. But making sure you have protective equipment that fits correctly, that's been tested for any damage or malfunctioning, making sure that there's good sportsmanship, that rules have been implemented, and that they're being enforced to minimize the risk of these injuries, and just being educated and knowledgeable on concussions and what needs to be done to treat them and to minimize the risk of them happening is important. Thank you very much.
Thank you.